Hi friends, once again good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC Nursing Officer exam, and this ESIC exam is on 7th July. Can download admit card 2 weeks before the exam. We can see previous year questions. First question, the test used to identify the frozen vaccine is options. Option A, shake test. Option B, shake test. Option C, patch test. Option D, dick test. Here are question, which test is used to identify frozen vaccine or freeze sensitive vaccine? Frozen vaccine means these vaccines, if we are keeping in the deep freezer, means the vaccine will damage. Okay, so they are freeze sensitive vaccine. The test which is used to identify freeze sensitive vaccine is shake test. Option A is the correct answer. Examples for this freeze sensitive vaccine is pentavalent vaccine, TT, hepatitis B are the examples. Okay, and we can see the next question. Most common cause of death in children due to diphtheria is options. Option A, septicemia. Option B, myocarditis. Option C, meningitis. Option D, tonsillitis. Diphtheria is an acute infectious disease which is caused by Corynebacterium diphtheriae. And the most common cause of death in children due to diphtheria is by myocarditis. Option B is the correct answer. Myocarditis. Move on to the next question. A baby is presenting with multiple deformities, cleft lip, cleft palate, microcephaly, small eyes, scalp defect and polydactyly is seen in which syndrome? Options. Option A, trisomy 13. Option B, trisomy 18. Option C, trisomy 21. Option D, trisomy 22. Here the question is, baby is having multiple deformities, that is more than one type of deformities that include cleft lip, cleft palate, microcephaly, small eyes, scalp defect and polydactyly. These all are seen in trisomy 13. Option A is the correct answer. Trisomy 13 is also known as Patau syndrome. Trisomy 18 is known as Edward syndrome and trisomy 21 is Down syndrome. Trisomy 13 is Patau syndrome. Move on to the next question. RRB scale is used for the assessment of options. Option A, pressure sore or bed sore. Option B, ventilator assisted pneumonia. Option C, level of sedation in intensive care unit. Option D, arterial circulation. Full form of RRB is Richmond Agitation and Sedation Scale. Okay, that is RASS, Richmond Agitation and Sedation Scale. This RRB scale is used to assess patient level of sedation in intensive care unit. So here the correct answer is option C, level of sedation in intensive care unit. Braden scale, which is used to assess pressure sore or bed sore. And option B, ventilator assisted pneumonia, which is used to monitor or which is used to screen by using clinical pulmonary infection scoring. Okay, that is CPI. Clinical pulmonary infection score. And the next question, 4 scale is used for the assessment of options. Option A, pressure sore or bed sore. Option B, impaired level of consciousness. Option C, appendicitis. Option D, arterial circulation. Full form of FOUR4 is full outline of unresponsiveness, which is used to assess impaired level of consciousness. So here answer is option B, impaired level of consciousness. Move on to the next question. In which disorder hidden menstruation present? Options. Option A, cryptomenorrhea. Option B, epimenorrhea. Option C, metorrhagia. Option D, all of this. Here the question is hidden menstruation. Hidden menstruation means already the girl or the lady is having menstruation, but the menstrual flow is not coming out. It is mainly due to any vaginal or any uterine obstruction. That is known as cryptomenorrhea. Option A is the correct answer. And second option, epimenorrhea. Epimenorrhea is also known as polymenorrhea, that is frequent menstruation. And metrorrhagia means option C. Metrorrhagia is irregular acyclic bleeding is known as metrorrhagia. The next question, symptoms of premenstrual syndrome present in which phase of menstrual cycle? Options, option A bleeding phase, option B follicular phase, option C secretory phase, option D all of this. Our question, premenstrual syndromes are seen in which phase of menstrual cycle? It is in secretory phase of menstrual cycle. Option C is the correct answer. And the next question, most common vaginitis in pregnancy will be option A bacterial, option B fungal, option C parasitic, option D viral. Our question, which is the most common vaginitis, infection of the vagina in pregnancy is fungal. Option B is the correct answer. Suppose if the question is most common type of vaginitis means it is parasitic vaginitis. Okay, here the question, vaginitis in pregnancy, most common type of vaginitis in pregnancy is fungal and most common type of vaginitis is due to parasitic infection. And the next question, strawberry spot appearance present in which type of vaginitis? Options, option A bacterial, option B fungal, option C parasitic, option D viral. Strawberry spot appearance present in which type of vaginitis? It is in parasitic type of vaginitis, mainly the infections of trichomonias, that is trichomoniosis cause strawberry spot appearance. And the next question, which organism is responsible for puerperal mastitis? Options, option A E. coli, option B Streptococcus, option C Staphylococcus, option D Rubella. Question is, organism responsible for puerperal mastitis, that means during the time of lactation. Mastitis means inflammation of the breast. So, inflammation occurs during the time of puerperal period or after delivery is by Streptococcus aureus. Option B is the correct answer. Suppose if the question is like the organism responsible for non-puerperal mastitis means it is by Staphylococcus aureus. Usually mastitis is caused by both Staphylococcus and Streptococcus. During the time of puerperian period it is by Streptococcus and non-puerperal period by Staphylococcus aureus. Move on to the next question. How much calcium is approximately required for pregnancy period? Options, option A 1600 milligram, option B 1400 milligram, option C 1200 milligram, option D 1000 milligram. Our question, calcium requirement during pregnancy. Both pregnancy and lactation, the calcium requirement is 1000 milligram. Option D is the correct answer. And calcium requirement for adults 600 milligram, infants 500 milligram, pregnancy and lactation 1000 milligram. And the next question, what reflex is an expulsive uterine contractions experienced by the mother during labor? Option A Chadwick's reflex, option B Ferguson reflex, option C pelvic reflex, option D urge reflex. Our question, a reflex occurs during the time of expulsive uterine contractions which is experienced by the mother during the time of labor is known as Ferguson's reflex. This is also known as ejection reflex. That is the reflex which is experienced during the time of expulsive contraction. And the next question, what is choanal atresia? Option A congenital obstruction of nasopharynx, option B congenital obstruction of oropharynx, option C congenital obstruction of urethra, option D congenital obstruction of middle ear. Question, choanal atresia. Choanal atresia means congenital obstruction of the nasopharynx. Option A is the correct answer. And the next question, fear of closed space is known as. Options, option A acrophobia, option B claustrophobia, option C aerophobia, option D gamophobia. Fear of closed space is known as claustrophobia. Option B is the correct answer. First option, acrophobia means fear of heights. And option C, aerophobia means fear of flying. And option D, gamophobia means fear of marriage. Here, fear of closed space is known as claustrophobia. And the next question, disulfiram is a drug used for the treatment of options. Option A, AIDS. Option B, alcoholism. Option C, mania. Option D, depression. Disulfiram is a drug which is used for the treatment of alcoholism. Option B is the correct answer. Move on to the next question. Which muscle injury causes torticollis during pregnancy? Options. Option A, smooth muscle. Option B, sternocleidomastoid muscle. Option C, skeletal muscles. Option D, all of this. Our question, torticollis. Torticollis means twisted neck. It is occurs during the time of delivery due to the injury of which muscles? It occurs due to the injury of sternocleidomastoid muscles. Option B is the correct answer. Move on to the next question. Who were the early pioneers of immunization? Options. Option A, Greeks. Option B, Egyptians. Option C, Chinese. Option D, Mesopotamians. I question, pioneers of immunization was Chinese. Option C is the correct answer. And the next question, neuroleptic drugs are also known as options. Option A, anti-epileptics. Option B, antipsychotics. Option B, antidepressant. Option D, hypnotics. Neuroleptic drugs are also known as antipsychotics. Option B is the correct answer. Move on to the next question. Which is an epileptic drug? Among the following, which is an epileptic drug? Option A, rifampicin. Option B, chloroquine. Option C, phenytoin. Option D, all of this. Among this, phenytoin is an epileptic drug. And the next question, Bohr-Havis syndrome means options. Option A, rupture of duodenum. Option B, rupture of esophagus. Option C, rupture of small intestine. Option D, rupture of colon. Bohr-Havis syndrome means it's a spontaneous perforation or spontaneous rupture of the esophagus. Thereby, patient may experience severe vomiting. So here, correct answer is a rupture of esophagus. Option B is the correct answer. Today we discuss questions from previous year question papers. Surely these questions will helpful for your studies. If it is useful for your studies, please share my videos to your friend circle.